Greeting from Bumrungrad Hospital Talks. My name is Assistant Professor Pansak Sugkraroek. I am Reproductive Endocrinologist, specialized in hormone management for health and wellness, together with anti-aging medicine. And this episode is about male hormones restoration for vitality. In this episode, I will talk about the importance of optimum hormones in the men to sustain health and vitality with restoration of sexual health by lifestyle, diet, exercise adjustment, together with bioidentical hormone therapy for restoration of optimum male hormone to achieve the goal of living long the healthy ways. Maintaining youthfulness through human lifetime is one of the goals for everyone. We want to live longer with good health and vitality. New concept of living long is living healthy. Testosterone level had been proved to be one of longevity index. Men with optimum testosterone level live longer than men with low level of testosterone. Testosterone and other essential hormones decline with age. Fortunately, hormone levels can be restored, improved, and maintained in healthy level through wellness lifestyle and bioidentical hormone therapy, with giving men the energy and vitality of their younger self. Did everyone know that testosterone is a fountain of youth? Some people think that testosterone works in many ways, but the real thing is that in men, testosterone is their fountain of youth. Testosterone is the predominant male hormone and plays a major role in a man's health and well-being. It is a source of energy and vitality, helping build a man's muscle mass and bone strength, maintain his sexual function, sharpen his memory and concentration, and keeping his mood the best way that he can control. Testosterone level decline as a man ages. After typical peaking in the late 20s, testosterone begins to decline at the rate of about 1% per year for a healthy male after aging of 40. What does it mean? It means that by the time a man turns 80, he is likely to have only about 20% of the testosterone he had at age of 25. At the end of the day, we do not want to sit and do nothing until testosterone level decline to less than 80% of maximum level of testosterone. Because in men, that will cause symptoms and the typical of testosterone deficiency syndrome or andropause will occur. Declining in testosterone level can produce a wide range of unwanted physical and emotional change, reduce energy level, mood swing, increased body fat, reduced sex drive, and erectile dysfunction at the end. Besides that, the declining in testosterone level will lead to the declining in bone mass, hair loss, and many more. This decline can also affect the man's ability to cope with stressful situations in his life and cause him to become socially withdrawn as he gets older. We know that all these changes of the human being, especially in the man, it can impact nearly every aspect of life. Not only him, it also affects the people who are surround him. Because when the level of testosterone level going down, that man tend to feel not so comfortable. He think on the negative way, he behave in a negative way, and because he did not know that the behavior that he behaved in a negative way because of the testosterone going down. He think with other, he think that he cannot sleep because he may get some disease, he may work not so well, but the foundation is that when men get older, the testosterone level is declining. And when the testosterone level is declining, nearly every man get this symptom. The reduce in energy and drive caused by the declining of testosterone can lead to lower productivity at work, impatience, and irritability can strain relationships with colleagues and employees, while causing rift with family members and friends too. Beyond the physical and emotional change, the hormonal decline less the risk of variety of chronic disease and major health threats. Men with low level of testosterone are at greater risk of cardiovascular disease, cancer, diabetes, osteoporosis, dementia, and frailty. We know that nowadays we have a symptom called NCD, non-communicable disease, that it can be prevented. And when it can prevent, it will lead to a lifelong with a healthy lifestyle. They also are more prone to depression, fatigue, bone fracture, obesity, as I told, and cognitive decline. All the symptoms of the body, mind, and social contribute caused by the low level of testosterone. Then we have to talk how to maintain the youthful level of testosterone in the daily life. Lifestyle change can make a significant positive impact on testosterone and other essential hormone levels. Healthy diet, proper exercise, and a good quality sleep, together with stress reduction, form the foundation of health and well-being. You have to change your way of eating. You have to incorporate more food that promote hormone production and maintain a healthy body weight. Like I say, sometimes I told all my patients that you have to live according to your circadian rhythm. You have to live according to your biological clock. You have to wake up in the morning, eat the food in the morning like a king, and eat like a beggar in the evening. Eat more fresh fruit and vegetable in the evening so that it will help fight with antioxidant property. We know we work every day. We use energy every day. And at the end of the day, we have a lot of free radicals to destroy us. But if you go to sleep well, the body will produce essential hormone to cope with everyday lifestyle. And that is a good thing. And did you know, testosterone level produced according to our biological clock. It will produce at night time when we sleep in the dark at midnight, and produce all night until have the highest level in the morning. At that time you wake up. Every man know that when you are young, when you wake up, you have something that sprung up in the morning before you go to the toilet. Our organ, male organ that sprung up in the morning, it one sign that you have very good testosterone level. When you get older, you do not have that sign. Also, in the afternoon, if you are good, you sleep well in the night, you have enough of testosterone in the afternoon to work well. And if you know, people in Europe, they try to have a little bit siesta or sleep every day after lunchtime. What does that do? It helps produce another batch of testosterone during daytime. But nowadays, we work so hard. We work since morning until the evening. Sometimes we work until at night. So the time for our body to produce enough of testosterone for a man is not enough anymore. We have to change our lifestyle according to our circadian rhythm and biological clock. Work during the day, sleep during the night, sleep in the dark, and turn off all the computer or the electronic signal so that you will sleep well. You also need to do some exercise up to 5 times a week, with a combination of aerobic exercise and resistance weight training to promote testosterone production when you go to sleep. First, eat. Second, exercise. The third is the active mind and spirit. Because if you have a good active mind, positive thinking, when you go back home, you will go to sleep well. When you go to sleep well, all the testosterone production is produced at night time when you go to sleep. The body's circadian biological clock is the physiologic control center that regulates sleep, body temperature, metabolism, and the release of essential hormone. Why it is important to go to sleep at the same time every day and to get a consistent of 6 to 8 hours of sleep each night. That's still not enough to slow the decline in testosterone production. Why? Because when we get older, the testes decline in function to produce testosterone. And also, when we get older, the body produce some protein to trap that testosterone so that we did not have enough of active testosterone during the day to work for us. So how can we do? The lifestyle change is the best solution for improvement of testosterone and other essential hormone production. The next best option is to consider that we can use what we call bioidentical hormone therapy. The therapy uses one or more bioidentical hormone to achieve the optimum hormone level. What does it mean for bioidentical hormone? And what does it different from the hormone that they use in the market? Bioidentical means natural and identical in structure with our body own hormone, not a synthetic hormone. So when we use bioidentical hormone to supplement the natural hormone in the body, it is safe to use for a long term and it can use continuously. Most of the time, bioidentical testosterone come from Mexican yam or sweet potato. Other plant also yield other bioidentical hormone too. But before you take any hormone, any recommendation for the doctor to be made, your doctor have to measure various hormone level, which is usually accomplished through a simple blood test done in the morning between 8 to 9 p.m. There are a number of methods available for checking the testosterone hormone therapy when you need it. When doctor check all your hormone and discuss with you that you are the one that are eligible and need the bioidentical hormone or testosterone therapy, they will discuss with you how we are going to use. The goal is to have the hormone absorbed fully and consistently to avoid spike in level. Actually, in the market, we have a lot of testosterone types. By mouth, by gel, by injection, by some patch, or anything that they have. So what is the difference in the concentration, in the action of every testosterone? We know that testosterone gel tend to be the most effective and popular method. Periodic blood test will help you to monitor that testosterone work. Testosterone gel you can use once a day in the morning and it can last long to another day. And then when it use something like that, it have to maintain the normal level in the physiologic range so that you can use the supplement of the testosterone for effective daily life. That is the thing that doctor want. Also, some people do not have time to do it every day. Long-acting bioidentical testosterone undecanoate come into light. And this you can injection every 8 to 12 weeks also for good response and well researched document. Men who begin with testosterone replacement therapy usually notice a difference almost immediately after 1 to 2 weeks in the term of feeling more energetic and vitality. That is not to say that the therapy is a cure for every male problem and the result vary by individual. So, to give the testosterone therapy, it are both art and science. You and your doctor have to discuss together so that it will come to the conclusion. How they can change your lifestyle, how you can change your lifestyle according to the body clock, how the doctor can adjust hormone or many hormone or some supplement so that it will suit you. Because nowadays we know that to treat the people to be healthy, living long and a lot of vitality, it needs cooperation between the doctor and the customer to talk together so that they will come to the conclusion and every day the patient have to adjust so that he will know how he can use more or how he can use less when he have come to see a doctor. And all this will incorporate into the daily life of the people who want to live long and healthy with a great vitality. Thank you for your attention. I am Assistant Professor Pansak Sugkraroek, Bumrungrad Hospital Talks. Please subscribe to our podcast for more episodes. Stay safe and healthy.